Autism is a complex developmental disability that typically appears during the first 3 years of life and affects a person's ability to communicate and interact with others. Autism is defined by a certain set of behaviors and is a spectrum disorder that affects individuals differently and to varying degrees. Now, there is no known single cause for autism, but increased awareness and funding can help families today. Do you care for or know someone who is autistic? Then this is the show for you. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Our first guest is Dr. Tina Gurnani, a child and adolescent psychiatrist with the Advent Health for Children's mental health program. We're going to talk about autism, which is a very wide spectrum, and try to get in the ABCs, if you will. So, what is autism? Let's just start at the beginning.
Autism is a neurodevelopmental disorder that starts in utero, so that means starts from pregnancy, birth, and it affects a child's development, social, emotional skills, and behavior.
Now, there's been a lot of controversy around whether vaccines or anything can trigger that. It's the first time I've heard that it is before the child is born, it's already there. Why the misconceptions then?
Yes, because it is a complex condition, and when something is complex and may have a number of factors that lead to it, it causes confusion for society and the public. And for something like autism, which can be for some people an emotionally charged topic, there's that desire in our brains to want to kind of pinpoint it to one thing.
Yeah, we want to know the why.
Exactly.
Yeah.
Versus this is something where research is ongoing into it. There is a genetics underpinning in as a cause of autism, although all the wide variety of genetic mutations and syndromes are not all known. Okay. So there are a few that are, so it's an ongoing topic, and that's not very comfortable always.
Well, we hear the word spectrum a lot. And a spectrum kind of indicates one end or the other. Why the use of that word when we're talking about autism?
So autism spectrum is used because it can present in different ways. So it doesn't always actually look the same in the end. However, it is all classified under the same syndrome, but it can have different levels of severity.
So let's talk about that. How do you recognize if someone is on the spectrum? Are there markers that you go, yes, that's it, that?
So some of the early signs of autism, of which there are many, can include a delay in the speech and language development, motor skills, social emotional skills, decrease in eye contact, in decreased back and forth conversation, sensory sensitivities or seeking of sensory input. They may have problems with hyperactivity, disruptive behavior.
So it can have a domino effect, if what I'm hearing. There are some co-occurring things that can signal the presence of autism?
Yeah, so what I mean to say is that there are various different signs, and not everyone with autism has all of the same signs.
Okay.
They may have some and not others, and that's why it's kind of called a constellation. So where once several things are noticed, especially delay in developmental milestones, but along with some of these other things, that's when the concern for autism arises.
How difficult does that make your job? You know, Where do you even start in therapies and treatments? Because it is such a wide variety of symptoms.
Right, right. So that is why ideally it's picked up early as 18 months of age even, or
Okay.
to 24 months of age. But the reality is that oftentimes it's not diagnosed until later, around 3 to 5 years of age, or
Is that
even
too
later.
late?
It's not too late. However, the best chances of improving outcomes and improving a child's functioning is early intervention. So that means as early as possible. So if we can start earlier, the likelihood of that having that effect and the most durable effect is in those early years. So that's why we want to pick it up early.
So what are some of the therapies and treatments that, once you say, yes, this is what we're dealing with, then what happens?
Yeah, so different therapeutic approaches may include things like occupational therapy, speech therapy.
And let's talk about what is occupational therapy.
Yeah. So occupational therapy is when a child has delays in their ability to go through their day-to-day independent living skills, and it includes motor and coordination skills, fine movements, gross movements, and includes sensory integration, sensory
Let's stop.
processing
Fine movement
problems.
versus gross movement. What's the difference?
Fine muscle movements includes things like handwriting,
Okay.
putting buttons on in your shirt, things like that. Versus gross movement has more to do with like coordination, the greater muscles in your body,
Okay.
throwing a ball, for example, hopping
Okay.
on a foot, things like that.
Okay. And what have you found to be the most successful therapies? Or is that an answer that's going to take longer than we have?
So the most successful thing is usually a approach in different directions, which can include speech therapy, occupational
Okay.
therapy. But it depends actually on what's going on with the child, I would say, because there's also specific behavioral interventions such as applied behavioral analysis, ABA therapy. But some kids may need psychiatric care for medications targeted towards specific uncontrollable symptoms.
Okay.
And it can also include social skills development. There's social skills therapy as well that can be very helpful.
If you could give parents just one piece of advice, what would you say?
I would say that the process of being diagnosed with autism can be somewhat of a process. So you want to be, persistent and be your child's advocate, because you want to go either through your child's pediatrician or family practitioner to start that assessment, and you'll likely need to be referred to a specialist, and that can include a pediatric neurologist, pediatric psychiatrist, or developmental behavioral pediatrician, and may include psychological testing for the confirmatory assessment. And so it may even include imaging and other tests, such as genetic tests and things. So because of issues just surrounding access to care, rural versus urban environments and things, my biggest suggestion would be your child's advocate, be persistent, make sure that no stone is being left unturned.
I think that is a great last word. Dr. Karnani, thank you. And thank you for everything that you do.
Of course, thank you.
We will be back right after this. Stay with us. Our next guest is Dawn Turnage. She currently serves on the board of the Autism Society of Greater Orlando and has a clinical doctorate as a nurse practitioner and a PhD research degree. Her current area of research is in pain and profound autism and exploring best practices for health clinicians to recognize and treat pain in individuals with profound autism. That is a very narrow slice of the pie. Why the focus on pain in health clinicians with people who've been diagnosed?
Pain because I'm a nurse, and I've been a nurse for 30 years, and nurses care for people. It's what we do. Pain assessment is part of the nursing practice, and in individuals with profound autism is a new label that's come up in the past 2 years. We've found that the individuals with profound autism are nonverbal, so they don't usually don't have any communication or have minimal communication. And in the hospital setting, it's very difficult for them to communicate their needs. And so it's sort of a partnership with my nursing background and my interest in autism.
So tell us a little bit about how we would recognize the signs of autism. We hear the word spectrum, and the very word implies there's one end and there's another end. So what should we look for? How would we confirm or suspect that someone has autism?
The autism spectrum disorder is a spectrum, and there are varied levels. It's very difficult to look at a person and say this person has or does not have autism, and so that's a challenge in diagnosing patients, but also in seeing people with autism out in the community.
Mm-hmm. Doesn't that make your job a little more difficult, though?
It does.
Yeah.
It does. And I'm a mom, and my son has profound autism, and it makes it difficult for our family because
so this
we
is
worry.
a passion project for you as well.
It very much is. Very much.
How did you know something was not where you thought it should be? And you're a healthcare professional too, so.
Right. My son right now is 22. So at around 2 years old, we noticed that he had limited language, and he wasn't developing the words like his older sibling was. Mm-hmm. And we also noticed that he wasn't making eye contact and that he was very distant. For example, when I took him to daycare, and I remember the first day I went to pick him up, and all the other kids were so excited to see their parents, and he just continued to play by himself with his toys, and he didn't look up when I called his name. Mm. Actually, the daycare worker said she'd been around a lot of children, and she said, "I'm concerned about your son. I think that your son has autism." And that was the first time that we heard that word, and we took him to the pediatrician and found that he had all of those signs that we talk about. So he had limited verbal skills and communication. He had poor eye contact. He wasn't developing the same way that other children his age were developing.
So let's fast forward, because part of your focus is helping the greater society understand that people who have been diagnosed may not respond the way they should. Law enforcement, teachers, talk about that piece a bit.
With law enforcement, we understand that the law enforcement officers want to serve the community and do what's in the best interest of the community. When there's an interaction with a law enforcement officer and an individual with autism, there's always a concern that the law enforcement officer might not recognize those signs of autism and might misinterpret that interaction as a person who's
not
cooperative or exactly, or is up to no good, when in fact it might just be that the individual doesn't have good communication skills, does not make eye contact because of their autism.
Okay. And the same with educators as well. It's important for them to be aware.
Exactly, educators, yes. And educators have that same communication aspect where they want to look into the eyes of their students, and students with autism might not do that, and that might be misinterpreted in students who may not have gotten that diagnosis when they were 2 or 3 and who might be school age and showing signs of autism and being on the spectrum.
So how does the Autism Society help bridge that gap?
The Autism Society of Greater Orlando is really good at providing community resources. They've been in the community for over 20 years. The board that I sit on is exclusively parents of children with autism.
Okay.
So we all know
this is a place of
autism.
support
Yes.
for parents.
And we support parents. We provide resources and tell them where they can go for information if they're struggling with their individualized education plans or IEPs, if their children are in school and are
Do
on that
they
plan.
even know that's a possibility for their children?
I don't know that parents fully understand the process of IEP. It's a kind of learn as you go thing. And so
that's one of
tapping
the
into
services.
those resources is really important.
And why did you decide to become a part of that organization?
I have been a member of that organization since my son was 3. We were very, very fortunate to make that connection, and someone referred us to the Autism Society of Greater Orlando very early, and they helped us tremendously along the way with identifying physicians, with navigating the IEP program, and just recently when my son aged out of the school system, navigating that transition to adulthood, which is a big transition because the school services, which usually provide therapies, stop. And then the individual with autism has to rely on different services.
So you kind of
that's
bridge
a big
that gap.
Bridge, yeah. And also going through the process of getting legal guardianship for your child. Because if your child is severe and they turn 18, the minute they turn 18, you don't have parental rights unless you have a legal guardianship agreement in place.
So there are so many layers.
There are so many layers.
And the Autism Society of Greater Orlando is the best place to start to get those
so
questions
in the community,
answered.
absolutely, because they're so knowledgeable, because we've been doing this for
You've
so
been
long,
there, yeah.
and because we're all parents who have experienced it ourselves and who really care about the families in the community who are like ours.
Well, I think that's a perfect place to say the last word. It's a place that cares about families who are dealing with this syndrome. Thank you so much, Dawn.
Thank you so much.
We'll be back. Discovered in our conversation today is that as much as we learn about autism, there's even more to learn, and it starts with education, and hopefully we got you on that road today. But the other part is you're becoming an advocate and asking the right questions of your healthcare professionals, because we want you to continue to have healthy connections. I'm Annetta Wilson. Thanks for joining us.